Hi, I'm Congressman Mike Quigley, and we're joined today with Elaine Weatherspoon, who lives in Chicago at Elaine Place. She has had diabetes for about 30 years, and for the last 8 years, she has been blind. And she's here to talk to us today about the future of the ACA and the Republicans' attempt to repeal that law. Elaine, thank you so much for being here to join us today.
Thank you, Mike, for having me.
So let me ask you, to people who don't understand, what's it been like for you living with diabetes for the last 30 years and being blind the last 8 years?
Well, for the last 30 years, well, let me start this way. I had sight all of my life, and I've lost my sight due to diabetes and glaucoma. I am a recovering kidney transplant survivor as well, with 7 years with my kidney. And with the Medicare, Medicaid situation, it's been good for me because where I live is for me to be covered with Medicare and Medicaid, because Freeman Place is covered by Medicare and Medicaid. And with my insurance, with the medications that I take, I need, the coverages for that. And plus with the money being cut, it's hard to, get what I need. It's hard to get the meds and the over-the-counter meds that the government is talking about. It's
Sure.
going to be hard for all residents, besides myself and the seniors included.
Yeah, let me ask you, what was it like before the ACA healthcare law was put in place? Living with what was a pre-existing condition?
Living with my diabetes?
Yeah.
It was hard. It was difficult in some situations. The only thing that really got to me is when I lost my sight, because I had my sight all of my life. And when it came to losing my sight and losing my kidney at the same time, it was really a big blow for me.
But in terms of how it was with your health care benefits and getting
Healthcare
insurance.
benefits with my insurance was it was okay.
Yeah?
It was okay. It was good.
Who insured you back then?
It was Medicare.
Okay, so you were under Medicare.
Yes.
But even then, now clearly the ACA did a lot to restore the vitality and maintain the viability of Medicare, and it also helped provide preventative care for folks like yourself who had pre-existing condition, right?
Yes.
Okay, very good. And how do you think the healthcare law has improved your life?
With some of the insurance, it has improved.
Mm-hmm.
With paying for some of my medications,
Sure.
it helps some. It's, a lot, because a lot of the meds I can't afford.
Right.
With one of my medications that I take for my kidney transplant, it costs $164.
Right.
And if I didn't have that, I had to borrow the money from my mother in order to pay for that med. But with the bill, if they cut it, then it's going to be hard for other people who can't afford it.
Right. How do you feel about the President and Republicans' the efforts to repeal the health care law?
I think it's really sad. It's hard.
Well, if they were in the room here, President Trump was sitting right here, or some of the Republican leaders, the attempt to repeal this takes about somewhere between 20 and 34 million people off of health benefits entirely. It puts Medicare at risk. And what would you tell the president or the Republican leaders if you had a chance to talk to them one-on-one?
I would say to the president and the Republican leaders, please listen to us. Please do not cut more than what you're doing. We need what we can get. We need all the help that we can get.
And you must know friends and family who are in similar situations, right? I mean,
Yes.
they would probably say, in your mind, the same sort of thing. Their
Yes.
concerns.
Mm-hmm.
What's your biggest fear if this gets repealed?
My biggest fear would be the nursing homes.
Sure.
Seniors in that situation. Because see, where I live is independent living for the disabled and the blind.
Your fear is you'd lose coverage and benefits.
Yes.
And you live with people who are in similar situations, right?
Yes.
So collectively, you're all concerned about each other, I suppose.
Yes, we are. We are one big family. So
Right.
everybody is helping out, and we all in the same boat.
Worried about your friends in the same situation?
Yes.
I appreciate that.
Thank you.
If there's one thing, let me just, if there's one thing that we could do to even help you even more, what do you think that would be?
To fight. Just keep fighting.
You got it. It's a
Keep fighting.
pleasure to meet you.
Thank you. Same to you, Mr. Quigley.
God bless. Take
Thank
care.
you.
All right.